We've tested over 8,000 people in our office. Over 97% are deficient in iodine. The vast majority is severely deficient in iodine. All thyroid hormone can't be made without iodine. Thyroxine, or T4, has 4 atoms of iodine attached to thyroglobulin. Triiodothyronine, or T3, has 3 atoms of iodine attached to thyroglobulin. In fact, any hormone in the body, you can't make any single hormone in the body without adequate amounts of iodine. You can push out iodine in the body with bromide, and vice versa. You can push bromide out of the body with iodine. Problem we've had is our iodine levels have fallen 50% over the last 50 years, and our iodine in our food supply has gone down. And at the same time, our exposure to bromide's gone up. Say it's created the double whammy of breast, ovaries, uterus, prostate, pancreas, thyroid problems that we're facing today. Hashimoto's and Graves' disease have gone up over the last 50 years epidemically, and iodine levels have fallen 50%. That's noted as a negative association. The negative association disproves the idea that iodine's causing this Hashimoto's epidemic that we're facing right now. Period. Exclamation point, it's over. That's not it. It's something else.
Dr. B, iodine is such a critical element when it comes to our health, yet there's a lot of controversy around it. Why is this?
I don't see too much controversy around it. Iodine's an essential element needed by every cell in the body, and our levels have been falling over the last 4 to 5 decades. And the vast majority of Americans are deficient in iodine. It's not that controversial.
Well, it is, though, when it comes to conventional medicine and people taking it as a supplement. Would you agree with that?
Well, I would tell you, pretty much all nutrition is controversial in conventional medicine, because I was taught in medical school that there's no need for any supplementation of anything, that our food supply provides adequate amounts of trace vitamins and minerals that are needed. And, I used to believe that at one time. And after 30 years of checking chemistries and looking at nutritional levels on people, I can now say that's clearly not true, and particularly with iodine. I mean, we've tested over 8,000 people in our office. Over 97% are deficient in iodine. The vast majority is severely deficient in iodine. I've talked to colleagues around the country and around the world who are seeing the same thing. I know it's not controversial in my mind, and I was sort of playing with you a little bit with that. But there are some that don't believe it. But, for those of us testing iodine, we can tell you that that's what's happening out there.
But where do you think this controversy started? Because even in the natural health world, it was something that I avoided for years. Now I'm taking a supplement, but it spans even beyond conventional medicine into the natural health world. And there's this fear, and you're stating here that it's unwarranted, but it's there. And I'm curious the origin of that.
Well, I think that that's an interesting question. So, let's go back in time to the early 20th century. And in the early 1900s, the whole country of the United States was suffering from goiter. Goiter is a swollen thyroid. Thyroid gland sits in the lower part of our neck, right here. And as you can probably see, I'm wearing a national championship sweatshirt here, just letting your audience know that University of Michigan is the reigning national champions right now, in case they didn't know.
Nice.
But back to the goiter. So in the early 20th century, there was this goiter epidemic, and it was occurring, as the country was expanding from East Coast to West Coast, east to west. And it was particularly prominent around the Great Lakes area where I live, where I practice medicine. And the Great Lakes area surrounding the Great Lakes, which is, Wisconsin, Illinois, Indiana, Michigan, and that 4-letter state to our south, it starts with a lowercase o. Our soil is one of the most lowest iodine levels in the world. And so iodine is known to concentrate in the thyroid gland. Iodine is necessary to maintain the normal architecture of the thyroid gland, just as it's necessary to maintain the normal architecture of all the glands in the body, including thyroid, ovaries, uterus, breast, prostate, pancreas. So when there's normal architecture, there's normal. There's no growths, there's no abnormalities in it. And an iodine deficiency, particularly with the thyroid, the first thing that happens is you start to get cysts, and if it goes on longer, they become hard and nodular, and the gland starts to expand in size and take on an abnormal architecture. And when it sticks out enough and you can see it, that's a goiter. So we can go into that story. I'm going to answer your question a little succinctly, and we can go into that story in more detail if you want. But the government recognized there was a problem in our population, and this goiter epidemic was occurring not only in humans, but it was occurring in animals. And the animals weren't growing to the right size and procreating correctly in the Midwestern United States as the country moved, again, from east to west. And there was a worry that from the highest levels of our government that the population growth was going to grow too quickly, and the food source couldn't keep up with it. We were going to what's the word I want to use? Outgrow the food supply. And so, studies were undertaken. It was known that iodine deficiency causes goiter. It was also known that iodine deficiency in animals can cause thyroid problems and procreation problems, and they won't grow to the correct size. So, in Ohio, there was a study undertaken to look at the lowest amount of iodine put in animal feed that would stop their animal thyroid problems and the animal procreation problems and the growth problems. And this was done right outside of Cleveland out of Case Western. And the researcher, he was a medical doctor, and I'm stalling because I just can't recall his name right now. It's in my iodine book, but he found the lowest amount of iodine added to animal feed that corrected their thyroid abnormalities and corrected their procreation and growing problems. From there, it was estimated how much humans would need to take care of their problems. And so there was a study undertaken, and first in Ohio and then in Michigan, for iodized salt. It was the easiest way to get iodine into a population of people. And they put the minimum amount of iodine in salt to prevent goiter. And a couple of years later, they found that it was, it did its job. The goiter rate went down, markedly in humans. And, the government, they didn't mandate it, but they pushed for iodized salt to be given to the rest of the country. And really, that's how iodized salt came into play. So from that moment on, the interest in iodine waned. So before then, iodine was the most used non-patentable item in medicine. In the 1800s, early 1900s, iodine was found in all apothecaries, and it was recommended for all medical conditions, particularly for infection. And infection was the number one killer at that time. So iodine, there's no virus, bacteria, parasites that's resistant to iodine. Iodine's still used today in conventional medicine, where they put it on your skin before you have surgery because it sterilizes the skin. So after iodized salt was introduced, it was hailed as the first public health miracle, which it was. And the interest in iodine declined dramatically. And there were reports, and I when I lecture about this, I go through the old literature. There were reports in the literature of a worry, before this iodized salt business, that iodine could cause, thyroid storm. And so iodine's always had this sort of undercurrent of, could it be a problem supplement? So when iodized salt came in, the interest in using iodine sort of just faded at that point. And really the only thing that was brought up from that moment on was problems with iodine. And then doctors were taught from that moment on, no one needs to take iodine. There's enough in salt, period. So if you're going to give iodine, you're only going to expose to adverse effects. So speaking to your idea that, you were afraid to use iodine at the beginning, well, so was I. In my first 10 years of my holistic practice, I was using a lot of natural thyroid hormone, but I was afraid to put people on iodine because I thought it was going to precipitate a autoimmune thyroid illness. And when I reflect back on that time period, it was my ignorance. I was iodine illiterate. And once I learned about iodine, started using it appropriately, I got over that fear very quickly, and I became iodine literate. And, so when I say it's not controversial to me. I've been using it for over 2 decades in my practice. We have 6 other practitioners in my office using iodine. We got nearly all of our patients on iodine. If we were seeing problems with iodine, we wouldn't be in business right now. It just wouldn't be happening. But
if you're enjoying this episode, let me know by clicking like and subscribe below. Thank you so much, and now back to the show. The part I'm still a little bit confused on is the fact that it came into salt as iodized salt, and it was, at that point touted as a miracle. And you mentioned quickly the fact with thyroid and initiating issues there. But you'd think, this thing comes into our food supply, it helps so many people, it would be looked at as good or neutral. But yet there's this controversy of taking it beyond what's in salt, which we'll get into later. It's not the salt you're recommending. But it's interesting, it was so stigmatized that people avoided it, and it wasn't just left even as neutral.
Well, it was taught at that point there was no need to supplement with iodine. They set the RDA for iodine for 150 micrograms per day, which is what you can get in from salt. The RDA was set up to not provide the optimal levels for the human body. It was to provide the minimal levels to prevent goiter and swelling of the neck. That's it. But what most people don't understand and don't appreciate is that iodine's in the skin, the breast, the muscles, the brain, the heart, the liver, all over the body. So it's not just the thyroid. And I can tell you 150 micrograms in our toxic world today is not enough for the body's needs for iodine.
Yeah, it's just interesting it went that way. And let's talk more on the salt piece, because this is typically how most people are getting a lot of their iodine, or at least, conventionally.
Well, getting iodine through salt is a pretty good method of getting the RDA for iodine in to a population, because human beings need and require salt. And I've written a book on salt called Salt Your Way to Health. The second major constituent in the human body next to water is salt. And we need adequate amounts of salt to run hundreds, if not thousands, of different reactions in the body and to make ATP or energy molecules, and almost to run most chemical reactions in the body. You need adequate amounts of sodium and chloride. So, putting iodine in salt was fine. And back then, there wasn't as much toxicity and toxic halides that we were exposed to. And, it was more beneficial. And it's not that it's not beneficial now, but it's been, we got a bigger problem now. Our bigger problem is, this toxicity load that's affected us that has made our iodine deficiency epidemic worse over time. So iodized salt is refined salt. Refined salt has all of its natural minerals mined out of it, and it's left with 98 point some odd percent sodium and chloride and a small amount of iodine and a small amount of other toxic chemicals that shouldn't be in salt, like ferrocyanide and aluminum silicate. Unrefined salt. So for the audience, when we communicated with each other about salt, we should refer to salt as refined and unrefined. Sea salt is not a good term. All salt came from the ocean at some point in its lifetime. So you could call refined salt sea salt. You could call unrefined salt sea salt. We need to refer to refined and unrefined. So unrefined salt examples are like Selena's Celtic brand salt, or Redmond's real salt, or Himalayan salt. These salts have different colors to them depending on the mineral content. And they don't have a lot of iodine in them, the unrefined salt. They have much less iodine than the refined salt. It's my argument that refined salt doesn't have enough iodine in it for the rest of the body, and unrefined salt has even less in it. But either way, I think people need to supplement with iodine in our world today.
And I could see how somebody who is in the health world and trying to make better choices using the unrefined salt that has less iodine, if they're not tuned into what we're going to talk about today and supplementing and getting the right foods, they could run into bigger iodine issues than the conventional person.
That's correct. That's absolutely correct.
So where do we begin? Somebody who is at this point, they know what iodine is, they haven't given it much thought, or they've been afraid of it. Where do they begin? How do they make sure how do they assess where they're at on the iodine spectrum? And then how do they begin to optimize it?
So I think first off, iodine should be part of a holistic treatment regimen. It shouldn't be the only therapy ever taken. And look, it's not only a thing, I'm not only putting people on iodine, I do a whole nutritional and hormonal evaluation on every patient who walks in the door. And, iodine's part of that, but so are many other things. So I don't think that you get the best results with iodine. It's just go take large doses of iodine or small doses of iodine. So I think, number one, it's important to learn about iodine. And that's one of the reasons I wrote my book. I first 10 years of my practice, I was trying iodine in various amounts, low, medium, and high. So let me go back. The first 10 years of my practice, once I left conventional medicine, I started diagnosing people with a lot of thyroid problems, a lot of people with thyroid problems. And I found at the end of a decade of converting to a holistic look at patients and looking at vitamin, mineral, hormone levels, that probably about 75% of my patients were diagnosed with a thyroid problem. And I was putting most of them on thyroid hormone. Now, these patients were feeling better and they were happy. I was following up with them, and, I was growing my practice and thought I was doing a good thing for them. But it was bugging me. Why do so many people need to take thyroid hormone to feel well? I didn't think we were designed by our maker to just, because we're getting older, we all need thyroid hormone to feel well. Human body's designed pretty well. If you supply it with the basic raw materials, that it will take care of itself pretty well. So I would look at the biochemistry and physiology of whatever I'm doing. In this case, the thyroid gland. I look at how does a thyroid gland make thyroid gland? What does it need to make thyroid gland? What are the cofactors needed? And when you look at that stuff, you find that B vitamins, particularly B2 and B3, magnesium, selenium, vitamin C, and iodine. All thyroid hormone can't be made without iodine. Thyroxine, or T4, has 4 atoms of iodine attached to thyroglobulin. Triiodothyronine, or T3, has 3 atoms of iodine attached to thyroglobulin. In fact, any hormone in the body, you can't make any single hormone in the body without adequate amounts of iodine. But the thyroid's particularly sensitive to that. And we've been designed for mechanisms to ensure that the thyroid gland gets enough iodine so it can make thyroid hormone, because we can't live without thyroid hormone, since every cell needs and requires it. So there's a specialized mechanism to take iodine from a lower concentration in the bloodstream, and to put it into a gland like the thyroid, which is a higher concentration. So you're moving from lower to higher. You need an energy molecule, an ATP molecule, to do that, to catalyze that reaction. And it's carried across the thyroglobulin membrane by a transport molecule called sodium iodine symporter. You need 2 atoms of sodium to drive that car across the membrane to get into the thyroid. That's where the salt comes into play. So you need adequate amounts of salt for this reaction to happen. You also need some iodine. Now, it's not just the thyroid. This sodium iodine symporter has been found in the breasts and the ovaries and other tissues of the body. But the thyroid has the highest concentration of iodine in the human body. Number 2 is the ovaries or the breasts. It's unclear whether, 1, 2, and 3. But these are and then the prostate is up there, the pancreas is up there. The adrenal glands have a high amount of iodine as well. So, our body works pretty hard to ensure that these glands have enough iodine so it can function and make these hormones that are life needed. So I'm getting in the weeds right now. I can't remember what your question was.
Well, why don't we take it here? We talked about deficiency early on being a goiter, and that's if we take things to the extreme. We know now that the thyroid hormones are made from iodine. What are some of the more subtle symptoms somebody's going to notice if they're not getting enough?
Well, they'll notice in the thyroid gland symptoms of hypothyroidism. That's one thing. So those are being cold, being tired, hair loss, weight gain, brain fog, like swelling, they're swollen. Their skin's all puffy because they got this mucinous fluid below the subcutaneous layer. And they're just dragging around. Now, the other thing that happens with low iodine is it's a setup for autoimmune thyroid disease, Hashimoto's and Graves' disease. And those people, they might be hyper and they might be losing weight and nervous and jittery and palpitations, but either one can be iodine deficient. And iodine's, as part of a holistic treatment regimen, as part of the treatment course for all those illnesses. But the most common one is hypothyroidism related to low iodine.
Well, let's talk more about the hypothyroidism piece, because this is something in the natural health world that if somebody has autoimmune thyroid, Hashimoto's, typically they're going to be told to avoid iodine. And according to your work, it is something to take proactively to prevent it and for treatment. And you have a personal story with both your daughters having that and using that as part of their treatment to regain their health. So how have you explain all that?
In the natural health world, what part of And I'm asking you this for a reason. What part of the natural health world is giving pushback on this idea?
To me, it's the people I talk to on the show, a lot of the people writing the books that are New York Times bestsellers and that are getting out to the masses and trickling their way down, the people from the US, Canada. To me, it's pretty much a consensus that, other than your work, that if we have Hashimoto's,
I'm not the only one out
which
there.
Even my wife has, so I'm pretty familiar with this. And we have thought that this is something we want to avoid, iodine.
So that stems back from, research, or it's almost like a wives' tale that's been put out there. But Hashimoto's was first described, I don't remember if it's the 1930s or 1940s. So where do you think Dr. Hashimoto was from?
I would say somewhere over in Asia.
That's what you would think, right? That's what I thought too. He's actually a German physician. So
there you go. Ignorance.
No, that's not ignorant. That's a little, I was not.
You tricked me.
I was not pimping you there, but it was just more to be a joke. But anyways, so Dr. Hashimoto was in Germany. It was after the introduction of iodized salt that he first described lymphoid hyperplasia in a thyroid biopsy and called it, Hashimoto's disease. So before the use of iodized salt, Hashimoto's was not seen. So that's how the whole idea that iodine causes Hashimoto's disease. And I have a whole lecture on this, and I go from the beginning to the present time, how this idea has just been perpetuated since then. So in Mayo Clinic, and there were two studies that went back. Mayo Clinic was one of them that looked back in time at thyroid biopsies before iodized salt and after iodized salt. And Hashimoto's was not seen in those biopsies before iodized salt. Now, we don't know if that's just because, maybe there weren't a lot of biopsies before iodized salt. I'm not sure of that. Or perhaps people just weren't checked for it back then. I don't really know. But Hashimoto's was only diagnosed after the introduction of iodized salt. So the appropriate question could be asked, is iodine causing Hashimoto's disease? Hashimoto's wasn't present before iodized salt. It's present after iodized salt. So, Jesse, do you have a degree?
Yeah, I have an undergraduate and a chiropractic degree.
Chiropractic. So you're a doctor. So you learned I don't know if we learned it in undergraduate, but we learned it in our doctor school that association does not equal causation, right? You have to do further research with it.
For sure.
So, but it's the appropriate question is to ask. It's an association. So the idea that Hashimoto's is caused by iodine started from there. And really, that's where it took off. Because there was no interest in iodine as a nutritional supplement, because that was after the introduction of iodized salt, that's what took off out there in the literature. And there are case reports of putting people on iodine and they become hyperthyroid. Now, I have seen 3 in my practice of using iodine for about 30 years. In our total practice with 6 doctors, 6 practitioners, we see a lot of patients. I don't even know how many over that time period. A whole lot. We have 3 patients who became hyperthyroid from taking iodine, and it was quick when they started to take the dose. And what they had was an autonomously functioning nodule. What that means is they have a nodule somewhere in their thyroid gland, which sits in the lower part of the neck, right above the national championship sweatshirt that I'm wearing right now. And when that iodine comes into play, the thyroid has lost its control mechanisms of making thyroid hormone. It's autonomous. That nodule takes up iodine and makes a lot of thyroid hormone, makes people hyperthyroid. If you do a radioactive iodine uptake scan on these people, they're going to get a hot nodule in that area, meaning it's taking up iodine fast and making thyroid hormone fast. For those people, they can't take iodine. They either get surgery and get that nodule removed, or they can't take iodine. And when they're exposed to iodine in larger amounts through food or supplements or something, they get a little bit hyper. So that's a contraindication to iodine. So unfortunately, those few case histories where that occurs, coupled with Hashimoto's only started after the introduction of iodized salt. And iodine, remember, after 1930s or so, when iodine salt was introduced, late 1920s or 1930s, there was no interest in iodine for anything in medicine at that point. So only the negative came out. And it just became sort of, gospel that iodine causes Hashimoto's and iodine can cause problems with the thyroid. I mean, look, I learned in med school, or it was taught to me in med school, and I was afraid to use it. And if you Google my name and some kind of statement that iodine is like putting fuel on the fire for Hashimoto's disease, you'll find it, because I said that somewhere in the first beginning part of my holistic practice when I eschewed the use of iodine. However, Hashimoto's only occurs, before again, the early 20th century and previous to that, Graves' disease was diagnosed in medicine, just not Hashimoto's disease. So guess what the treatment for Graves' disease was at that, early medicine?
Iodine.
And there's case report after case report after case report. Iodine was given, for Graves' disease, and so it was thought that iodine deficiency causes Graves' disease, which I can tell you it does, because I've treated lots of Graves' patients in my practice. We meaning my friend, my colleagues in my practice and myself, we like seeing Graves' patients. They're easy to treat holistically, and we have never sent a patient for radioactive iodine uptake treatment for Graves' disease. And I have sent maybe 2 patients in 30 years for surgery because we couldn't get their thyroid controlled. But I've never had to use radioactive iodine, which is a really dangerous treatment and should be the last resort for treating Graves' disease. But so the idea was out there that iodine caused Hashimoto's disease. So it was a reasonable question to ask. But the other reasonable question to ask is, well, maybe it's something else. Maybe it's iodized salt. Maybe it's the ferrocyanide or the aluminum silicate in refined salt that was causing this increase in Hashimoto's and Graves' disease. Maybe it was the exposure to aluminum and toxic halides like bromine that became, right around that same time. We'll talk about halides, but bromine became in use in medicine and became much more. Bromine toxicity took, started rising at huge amounts, right before World War II, and then it's continued until today and just gone up and up and up, which causes problems with the thyroid and problems with iodine. Maybe it's these things, but so let's move ahead now to the government's. I'm going to answer that question, and what I'd like you to do when you have these people on your show is you can ask them this question, because as Ricky would say to Lucy, explain this to me. Over the last 50 years, the National Health and Nutrition Examination Survey is clear that iodine levels have fallen about 50% across the United States. Every 8 to 10 years, the U.S. government undertakes the National Health and Nutrition Examination Survey. It's called NHANES, and they measure a cross-section of about 10,000 Americans for vitamin levels, mineral levels, toxicity levels, and they report the numbers, and we see sort of what's happening over a time period. And what you can see is a direct decline of iodine levels over this time period. Now, I'll ask you the question, since 1970, which is about when this NHANES stuff started, which is, 5 decades or so. From 1970 to now, has Hashimoto's disease, has autoimmune thyroid disease gone up or down?
Up in a big way.
Huge way, an epidemic way. 30 years ago, when I was in my training, I didn't see much of this. If I saw a Graves patient or Hashimoto's patients, it was an anomaly, and it was really something. And wow, look at this. Now you see it in kids. As you brought it up earlier, I saw it in my kids. Or my wife saw it first. We can talk about that. But so Hashimoto's and Graves' disease have gone up over the last 50 years epidemically, and iodine levels have fallen 50%. That's noted as a negative association. The negative association disproves the idea that iodine's causing this Hashimoto's epidemic that we're facing right now. Period. Exclamation point. It's over. That's not it. It's something else.
Okay, fair enough. But I want to clarify something before you continue here. What I was referring to before is that when you have Hashimoto's, you want to avoid iodine. I hadn't, up until your work, I hadn't come across anything about iodine increasing the risk of Hashimoto's. But what's known in the natural health world is that when you have it, you stay clear of iodine, which I know you're against. So I want you to get into that nuance.
We'll get into that. But before we get into that, I think we need to clarify this whole idea that it's in the natural health world. These people are not saying that iodine, they're saying that iodine causes Hashimoto's disease. They're saying that iodine worsens Hashimoto's disease. They're saying iodine causes Hashimoto's disease.
Okay. So not in my world, but okay.
Those naturopaths are saying that thing. I've heard them say it. So anyways, this negative association disproves the idea that iodine is causing Hashimoto's disease. So does iodine worsen Hashimoto's disease? Well, I can tell you, if that's your hypothesis, then you only need an N of 1 of anything. Hypothesis has to withstand all criticisms, or it has to be redone. So my daughters are 28 and 29 years old. They're physicians. They're working with me in my office, which is fabulous. And they were probably 10 and 11 years old. We're having dinner. And my wife says to me in the middle of dinner, "You think they got thyroid problems?" And I remember I had a fork or a spoon near my mouth, and I set it down and I put my hand over my forehead like this, and I'm like, "Oh, you're probably right. They've been complaining of headaches and being tired, and they were having these chronic headaches, just as their bodies were starting to change a little bit." And so I brought them in the office. I checked their blood work, and lo and behold, they both got raging Hashimoto's disease, titers in the 500s and TPO and thyroglobulin titers in the 500s or 800s. I mean, I wrote about it in my thyroid and iodine books. And so the first thing I did was put them on iodine, 25 milligrams, and they were 10 and 11 years old, so they were small adults at that point. And took gluten out of their diet at the same time. So it's not that we just did iodine. They were already off gluten before then because they had some problems with that on testing. And really what we did was really iodine because I already had them on nutritional support. And so when I lecture on this, I've got my daughter, they both showed the same thing, but I got Haley's lab tests over the years showing these titers going, starting up here and then here and then here and then here and then here, all the way down. And Haley's 29 years old right now, has no signs of Hashimoto's disease. Jessie, same thing, started up here, and she virtually has no signs of Hashimoto's disease. She's got titers like the single digits, which is it's a little bit above the reference range, but it's not much. I would say you don't have Hashimoto's disease. Maybe I'm not 100% correct on that one, but so here's an N of 2, and I've got way more than that because I've done this with my patients. So it's my premise that Hashimoto's forms from low iodine, this dropping iodine level at the same time in these 50 years that we've had these rising halide toxic levels has caused this Hashimoto's disease, and the treatment for it is iodine, which will correct iodine deficiency and cause the halides to release from the body.
Okay, just to summarize what I think you just said there. So not only does iodine not cause Hashimoto's, the lower iodine we're taking in as a whole is a contributing factor to Hashimoto's, and part of the treatment is to make sure you're upping your iodine or getting a sufficient amount, I should say.
My experience after 2.5 decades, over 2 decades of using iodine and treating, I'm assuming between me and my partners, thousands and thousands of patients, is that Hashimoto's isn't that hard to manage. And my kids have no signs of it now. So, ask those people to explain that one. Their hypothesis needs to be redone.
All right. Well, let's come back to general population now. Somebody living, we can take any example in the U.S. It sounds like this is an issue across the U.S., but your area in Michigan sounds like a hub where it's more concentrated due to the geography there. So I'll have you clarify. Give me a picture of the U.S. and if there's any areas there that are not dealing with this. And then I know from what you said before, the area you're in is a area of lower iodine.
So That's correct. The Great Lakes area is lower iodine in the soil, but we're pretty much all eating the same food across the country now. We get the food from the same sources. Nothing really distinguishes it. I've talked to my colleagues around the country. They're all seeing those who are checking it. So one of the reasons that you're saying, I might have a hub of it is because I'm checking for it. Look, you only see what you look at. And if you're not checking for iodine levels and you're not checking for Hashimoto's, you don't know what people have. You don't know if they have it or they don't have it because you're not checking for it. So,
But you are in a geographic hub where it's lower, the iodine.
Well, it's lower in the soil, but I think that I've talked to the lab testing. Our country has become so messed up with pollution and our food supply is dropping nutrient levels that it's across the country. And I don't think we're suffering much any more than everybody else. I think the whole country is suffering about the same amount these days.
Okay. Important we got into that. And your number was 97% from practice that people are deficient. So given that, is testing necessary, or can we assume that we're deficient if we haven't been addressing this? And if testing is warranted, how do we do that? What's the best way?
I don't think everyone needs to be tested for everything all the time. However, if you don't look for it, you don't see it. And if you don't test for Hashimoto's disease, how do you know that's there? I'm pretty good at palpating thyroids. When I do courses, I teach doctors how to palpate the thyroid. And I can tell you, the vast majority of doctors are inadequate at palpation skills. That's a lost art in medicine, and particularly with the thyroid. So do I think everyone needs to be tested? I think that a spot urinary iodine test costs a few bucks, and it's a very inexpensive way to sort of screen someone for their iodine levels if they're not taking iodine. However, if they're taking iodine, the only test available, if you're taking milligram amounts of iodine like I'm writing about and talking about, then the only test available is a 24-hour loading test. And it's a more involved test where you take 50 milligrams of iodine at time zero, collect 24 hours of urine, and because 98% of the iodine taken orally comes out in the urine, you can measure the amount in and out, subtract the numbers, and realize how much the body's holding on to. And when about 95% is excreted of that 50 milligram load, or 45 milligrams comes out in the urine after 24 hours, usually that means there's a 5 milligram pool of iodine that the body's utilizing to make thyroid hormone, adrenal hormone, help the immune system, or whatever the iodine's supposed to do on the body. When the body excretes 25 milligrams or 50% and hangs on to 25 milligrams, it's really deficient in having to get its stores back up. So that's a functional test that can be done. Do I think everybody needs that? No. But I think everyone could benefit from working with a holistic doctor who's iodine literate and not iodophobic, which, you brought up, the interviews you've had earlier. I would call those people, suffering from medical iodophobia, and they need to get their literacy up to snuff.
Okay. So for the average person, it sounds like testing, would be a good idea, but not always necessary. Obviously, there's different ages in the population, and I'm assuming depending on the body size and the age, dosage would be different. Can you give us a general idea of what you're recommending? We know it's in milligrams, but what kind of dosages are people typically on when they're working with you?
I would say the vast majority of my patients are on 25 milligrams of a combination of iodine and iodide. And if they have glandular disease, thyroid, ovaries, uterus, breast, prostate, pancreas, I'll put them on more. If they have cancer, because that's the end of that iodine continuum that I touched on earlier, I put them on more. And I use iodine as a front and center, first line treatment for people with glandular problems. And we got a country of glandular problems right now. 1 in 7 women across the U.S. have breast cancer. 1 in 3 men, older men, have prostate cancer. We have thyroid cancer is the fastest growing cancer. We have pancreatic cancer, ovarian, uterine cancer going at epidemic rates right now. And it's been my premise that iodine deficiency is probably not the sole cause of that, but it's a large piece of that pie and needs to be identified and dealt with. in order to help those conditions.
You mentioned there being a difference there between iodine and iodide. Can you talk about what that is?
So those terms, iodide, DIDE, refers to the reduced form of iodine. It has its full complement of electrons in its outer shell. We can all go back to biochemistry, undergraduate inorganic biochemistry. And iodine, DINE, is the oxidized form, where it's lacking an extra electron in its outer shell and is looking for an electron. So that makes iodine the perfect redox reagent, where it can function as both an oxidant and an antioxidant, which are really the most potent healing things in the human body. Vitamin C functions like that. Vitamin E can function like that. There are glutathione can function sort of antioxidant and oxidant, and these are the most potent healing things in our body, and that's what makes iodine such a neat thing to study. So my first 10 years of my practice, what I was using was iodide, DID, the reduced form, because I was not iodine literate and I was ignorant. What I found was small, medium, and large doses of iodide only didn't help people. They didn't get worse. They didn't get better. And I would get frustrated with it. My turning point came around year 8 or 9 when I saw a letter to the editor from one of the journals that I got that a doctor in California, his name was Guy Abraham, had developed an iodine loading test. And there was no good iodine testing before that time. So I saw that and I'm like, whoa, let me call him. So I called him and we started a deep friendship and personal and professional. And I would fly out to California and, work in his lab 6 times a year for a long weekend. And he got my iodine literacy up to snuff. And one of the major things he taught me was different tissues of the body respond to iodine, different respond to iodide. So, for example, the thyroid responds to iodide, seems to take up iodide only. The breasts take up iodine. So the stomach and the pancreas and the ovaries and things respond to one or the other primarily. Now, I just said the thyroid takes up iodide. I just said the first 8 years of my practice, I was using iodide, small, medium, and large doses without effect on the thyroid. It just didn't work. So when I started using a combination of iodine and iodide, such as found in Lugol solution was made in 1820s by Dr. Lugol, and it's a combination of iodine and iodide in a potassium liquid substance. And that was what was used in medicine until iodized salt came into play. And then there was really, according to conventional medicine, no need for iodine at that point because we were getting enough of iodized salt. But when I started using Lugol solution, a tablet of Lugol solution, when I started to see the results that I was looking for. And that gives you a whole body effect for iodine.
All right. So we want to combo the both. Different tissues prefer different forms. You mentioned the Lugol. I've used that in the past. That's a liquid that comes out kind of like brownish orange. And then you also mentioned capsule. Let's talk about the different forms of iodine. Now we know there's the 2 different types, but the different forms we can take it in and what's best.
Well, you could take either. You could take tableted iodine and iodide, or you could take liquid. It doesn't really matter. I haven't found it matters. So, I prefer a 5% Lugol solution, which is 1 drop is 6.25 milligrams. There are tableted forms on the market now that are 12.5 milligrams per tablet. Either works just fine. I have not really found a big difference, between the 2.
Okay. And how do you feel about transdermal, using the solution through the skin?
So that's been sort of another wives' tale with iodine, that you could put Lugol solution, brownish, iodine, which is the brown color, on the skin, on the forearm or up here, You make a brown patch, and then you time how long it takes for that brown patch to go away. So the theory was that if the body was really deficient in iodine, it would soak up the brown colored iodine here, absorb it through the skin. The skin holds about 20% of the body's iodine. And the quicker that brown color went away, the more deficient you were. So if the brown color lasted 24 hours, your skin had enough iodine in it. And so it's called the skin What is there a name for it? Do you know a name for it?
Not that I can recall, no. But I used to do that. That's how I initially supplemented years ago.
I used to do it
Took
too.
a break from it for a while. Now I'm on capsules. Sorry, continue.
Well, I used to do the test too and thought I was getting useful information. Well, when I found out the skin had 20% of the body's iodine, maybe that's all you're measuring with it. But there was a study that measured it and showed 88% of when you paint it on the skin, sublimates off into a gaseous phase and goes to the atmosphere. So it's pretty much a useless test. There's no value in that. The best test is urinary excretion testing.
And I would assume since it's, not absorbing, that it's not a good way to get it in the body either.
No. Taking it orally is the best way to do it. And iodine absorbs really well from the GI tract. So after testing people long enough to know this, you can, that's why the urinary excretion, because it's getting in because they're clearing it through their kidneys and their urine.
This current capsule I'm taking, it's 1 capsule every 2 weeks, which gets me to how often do we need to take it? How is it being stored in the body and how often do we need to take it?
What 1 capsule every 2 weeks mean? What's that about?
You know what? I was just taking it without, doing a ton of research. And now that obviously I've dove into your work to prepare for this interview and conversing with you here, my level of knowledge on iodine's gone up exponentially, and I'm going to look further into it. But I'm not even sure the exact amount I'm taking. But it says on the bottle, it's Designs for Health, which is, in my mind, a pretty reputable brand, to take 1 capsule every 2 weeks.
I don't see how that's possible because when we finish this show, if you're home and you have that bottle, if you could show it to me, I'd like to see that.
I'll go grab it.
I'm not sure that's possible because we're not iodine camels. We don't have humps that store iodine. Similar to water, we don't have humps of water. So if we don't drink water on a daily basis, we become quickly dehydrated. And iodine will clear out of the system 24 to 48 hours if you're not taking iodine. So I don't know, unless this capsule is staying in your gut for 2 weeks, slowly releasing iodine and iodide, which I really doubt that's the case, then I think that's incorrect information.
Okay. Well, it's important we're getting into it because, there are fat-soluble vitamins like vitamin D, DAKE, DAKE, that do stay in the body for longer periods versus something like vitamin C or magnesium. And with the fat-soluble vitamins, you need to be more careful with dosages and how frequently you're taking them. So why I got into this is I'm just curious, iodine, how it fits on that continuum. And you're saying 24, 48 hours is all we got.
That I've done the testing on. And I can tell you that there's a little bit of a carryover effect from iodine, but iodine's rapidly, when it's not utilized, it's cleared. So, you need iodine on a continuous daily basis to make thyroid hormone, adrenal hormone, keep the glandular tissue in normal architecture. And and it needs to be replaced or you become iodine deficient very quickly. And then couple it with our exposure to all these pollutants that push iodine out of the body and displace it. I would be hard pressed to believe, taking a pill every 2 weeks is going to do much.
Well, let's move into the halides. You've touched on it a couple times. These other competitors, these other elements that are battling for the receptors that iodine needs to get on.
So the halides are I think I got a picture of the halides in my iodine book. Maybe I don't. I do not. So the halides are, if you recall back from high school chemistry or college chemistry, for those who took it in college, it's the periodic table of elements, and they're grouped according to this, from the size, from lowest size to the largest size, and then they're grouped according to similarities between groupings. And group 17 on the right side of the periodic table are the halides, and there's 5 halides now. A 5th one's been discovered, but I don't think there's any human. I don't think it has any relevance to us. The 4 major halides are fluoride, chloride, bromide, and iodine. And 2 of those are essential and 2 of those are toxic. The 2 essential ones are iodine and chloride. We can't live without either of them. we've been talking about iodine, chloride, salt, sodium chloride. We have huge amounts of chloride, over a gram of chloride, over a gram of sodium. If we look at dry weight of our body, those huge amounts of those things, and it's needed because that's to make energy molecules, to run hundreds and thousands of different reactions in the body. Every cell needs chloride. Every cell needs iodine. Bromide and fluoride, toxic elements, should not. They shouldn't be in our body. We can argue whether fluoride, treats cavities or not, but I don't think it does. And fluoride poisons hundreds, if not thousands, of enzymes in the body, and it's a very electronegative, small substance. It's very toxic to the human body. Bromide is fluoride's in our water supply. It's in toothpaste. It's in juices and drinks and dental. They do the fluoride treatments and all that stuff. And bromide is another toxic halide that is the bigger problem of the halides, of those two toxic ones, because fluoride's so small. It's the work that I did with Dr. Abraham, we couldn't demonstrate that fluoride competitively inhibited iodine, even though it could, because it's in that grouping, but we showed bromide did a nice job of that. And if you look at the size of bromide and iodine, they're very similar to one another. And bromide would be the choice. If you want to competitively inhibit iodine, you choose bromide because it's more size-wise closer to iodine and could bind to its receptor much more efficiently than fluoride would. But, we're getting exposed to bromide in food, drink. It's in consumer goods. It's in these things, and it's probably in this sweatshirt this sweatshirt, which is the national championship sweatshirt, in case you guys didn't know. But it's a fire retardant in clothes. It's in cushions. It's in your mattresses. It's in vegetable oils. It's in breads, and bakery products as brominated flour. So our exposure to bromide is what I think is a double whammy. First one is iodine levels falling over the last 50 years, and the bromide levels rising. That has really double whammied us and given us the impetus for the epidemic of cancer of the thyroid, ovaries, uterus, breast, prostate, pancreas, as well as Hashimoto's, Graves' disease, and other problems as well. And so that to me could explain why we're seeing this epidemic of all these problems.
And then getting further into the bromide piece, there was a time when iodine was used in baking, and you talk about this in your book, where it was subbed out for bromide. So talk about when that is and what we noticed at that time.
So before the 1970s, iodine was used in flour and breads, pasta, cereal, whatever else flour was in, baking products, had iodine. So was it one or two slices? I think I should know this. It was one or two slices of bread met the RDA for iodine. So not only were you getting iodine and iodine salt, you were getting iodine in a couple slices of bread and cookies and whatever else was using iodinated flour. And then in the it was around 1970, 71. The government didn't mandate it, but brominated flour the government began promoting the use of brominated flour, and it's unclear why. I've spent many hours trying to find why, and I can't find why. But right around 1970, bromine took the place of iodine in bakery products as a conditioning agent. And that worsened. That's really when problems started developing in our country with the thyroid, the ovaries, uterus, breast, prostate. When Hashimoto started to take off after that, a few years after that. That's definitely an inflection point in this discussion that has been a big problem and is still an ongoing problem today. So I'm not sure why it happened, but it was interesting to note in the early 1970s, before 1975, radioactive iodine use began exploding in medicine. So they would inject you with radioactive iodine and look and see where the tracer goes. So if they're looking do you have a hot or cold nodule on your thyroid, they'll inject radioactive iodine and see, does it take up this radioactive tracer or not. They can do it for breast tissue. They can do it for other tissues as well and other studies. So the problem with radioactive iodine testing in medicine, it doesn't work if people are iodine sufficient. If all the receptors are saturated with iodine, the radioactive iodine has nowhere to bind. So I'm asking the question is, was brominated bakery products substituted for iodinated bakery products because there was a benefit to having us iodine deficient so they could do these radioactive iodine tests, which are done widely in medicine today? Now, I don't know. I don't know if it's that nefarious or not, but, I think the question should be asked. But either way, here we are, 50 years later, where, I did a study in my, my iodine book where I compared a group of breast cancer women to non-breast cancer women. That's all I screened the difference of. We did an iodine loading test at day, before they started treatment. We did another loading test day 1 and another loading test day 30 after taking 50 milligrams of iodine for 30 days. And what I found was that breast cancer patients had 50% less iodine in their bodies at the start and 50% more bromine compared to women without breast cancer, just as you would expect when you know the physiology and biochemistry behind these halides.
Well, let's talk more about the physiology piece for an average person that hasn't been taking iodine, and assuming that from the current world we live in, they have the bromine. Is bromine, can we use bromine or we have to say bromide? Are both interchangeable?
Well, bromine's the oxidative form of bromide.
Okay. So bromide, we'll say the person is taking in bromide throughout their system and it's taking up these receptors. What happens when they start to take a significant dose of iodine in the body, the physiology?
So we learn about competitive inhibition when we have to take our chemistry classes. And what that means is that on the periodic table, when the elements are grouped together, you can competitively inhibit one with another. So in the group 17 of the halides, and since iodine and bromide are somewhat of the same size, they might fit into the receptor locking point very similarly, that you can push out iodine of the body with bromide and vice versa. You can push bromide out of the body with iodine. The problem we've had is our iodine levels have fallen 50% over the last 50 years, and our iodine in our food supply has gone down. And at the same time, our exposure to bromide's gone up. And I lecture about this. I say it's created the double whammy of breast, ovaries, uterus, prostate, pancreas, thyroid problems that we're facing today. And unless we rectify that problem, I don't see us making progress in those.
But what I'm getting at is, say the iodine comes in, it's knocking the bromide off of the receptors, taking the places. What happens to the bromide in the body? Do we just excrete it through our feces and urine? Do we have to be careful how fast we do that? Are there things we can take to bind that as it's being expelled by the body?
So if your receptors are full of bromide, you can start taking large amounts of iodine. Sure, you're going to displace that bromide. And if the iodine's binding to because receptors preferentially prefer iodine over bromide. So the body's got no use for bromide except for binding to the iodine's receptors. There's no known therapeutic value of bromide in the human body. So it has to be released. And some people get sick from that. That's one of the side effects of iodine, where you can trigger a detoxification reaction, or fancy term is called a Herxheimer reaction, where bromide gets released. And if these aren't good excretors, if these people have some problems getting toxins out of their body, they can get sick, like flu-like sick or headachy or fatigue, achy, brain fog, and blame it on iodine. What's really not iodine is bromine toxicity that causes that. So you can aid that. Now, a lot of medicines have fluoride and bromide as part of their chemical makeup. Antidepressant drugs have fluoride as part of, a bunch of them have fluoride as part of their chemical makeup. And there's still drugs that have bromide as part of their makeup, some of the asthma drugs and some others that are out there. Now, it used to be much more. And I am old enough, pretty sure I'm old enough to remember the ads for Bromoseltzer. Bromoseltzer was a precursor to Alka-Seltzer. And bromoseltzer was used for, same thing Alka-Seltzer is used for now, gastritis and upset stomach and stuff. So people would get bromide toxicity from using bromoseltzer or some other conventional medicine. And what they would do is they would become delirious. They would be, fatigued and brain fogged, and they'd be taken to emergency room, almost like a hallucinogenic or a psychotic episode. And once it's diagnosed appropriately, do you know the way to get bromide out of the body, Jesse?
I mean, I would say you're going to use some iodine.
So you displace it. What helps to get bromide out of the body once iodine's displaced it?
That's what I was asking you. What can we do to bind it? And salt. There you go. He's holding up his salt book for people listening.
So the treatment back in the day for bromide toxicity, which diagnosed a lot, was to salt the bromide out. They would put an IV of saline, and they would just give them saline until the bromide comes out, and the sodium combined bromide, and then the kidneys can release it as sodium bromide. What I tell people when they go on iodine is they have to use salt with it. They have to use unrefined salt. And I never put anyone on iodine ever without, number one, checking salt levels, number two, putting them on salt, because I know they're going to have a release of bromide. And I can tell you I get very few problems with it. If there are problems with it, I tell them stop the iodine, take more salt, and then try it again in 2 weeks. And most people can take it. Are there some people can't take iodine? Sure. Some people can't take vitamin C. Some people can't take magnesium, but very few.
So you've mentioned salt's part of this treatment. It gets me thinking about chloride being a halide. Does it ever compete with iodine?
No.
For binding?
No, because we have chloride receptors in our body. We need a huge amount of chloride. Chloride will not displace iodine. It's the toxic halides that don't have the receptors. It's bromide for sure, and I'm not as certain on fluoride. But fluoride is it's more toxic than bromide. It's just in a different way.
When you were talking about bromide before, you talked about a number of different areas where it's coming into the body. It sounds like it's pretty expansive in the modern world. Do you try and avoid that at all? Or is it more just trying to get enough iodine? Obviously you do, but are there any big ones, I guess, is what I'm getting at, areas that we want to make sure we're checking off the list and not taking in huge amounts of bromide?
No, that's a perfect question. You can avoid bromide. You can eat non-brominated bakery products, non-brominated bread. If you make your bread with iodine as a conditioning agent, not bromide. Drink soft drinks that have bromide as brominated vegetable oil in them, which are still out there today. You can buy mattresses that are made with bromide as a fire retardant in them. Bromide is been banned in Europe as a fire retardant. Here, it's still used. It's all over the place.
Well, the reason I asked a question like that is because you mentioned your shirt. So it's like it's everywhere. Is it even worth trying to, other than some big areas I wanted you to address, like how much nuance do you get into avoiding it?
So I usually talk to my patients about avoiding it in their food supply, in their drinks, drink and food. As regarding this national championship sweatshirt, I don't know if it's got bromine in it. I'm assuming it does as a fire retardant, but I can tell you it's in a lot of clothing, and it's in mattresses and couches and curtains and carpet. And I don't know how you're going to avoid that stuff, all of it. So you made a good point that the way to deal with it is you take enough iodine that you can bromide is nowhere to bind in the body. It should just pass through you and pass out.
Which gets me thinking about radioactive iodine from nuclear war. One of the things that we're instructed to do is take iodine to fill those receptor sites to not take on the radioactive iodine, which is extrapolated into what you're saying here about bromine.
Same argument exactly. When Chernobyl blew its top in 1980s, Soviet Union, or I don't know, they were Soviet Union back then, the governments, Russia, passed out iodine tablets to the population. So they could try and quickly saturate the thyroid in the breasts and the ovaries and uterus and pancreas with enough iodine. So when the radioactive iodine gases came over them, it would just pass through their bodies without binding to the thyroid and start to damage DNA, start to cause all the problems that can happen with radioactive iodine. And it's a similar thing we talked about earlier with conventional medicine using radioactive iodine as a treatment or just a diagnostic test, that it only works if you're iodine deficient. So maybe in the 1970s, there was a push because we wanted to be able to do these radioactive iodine tests to drop our iodine levels. I don't know if that was the case or not, but I think the question deserves asking.
And when it comes to using it in a medical setting for testing or ablation of the thyroid, if somebody has hyperthyroidism, what I'm guessing you typically won't hear talked about is the fact that iodine receptors and iodine is taken up throughout the whole body and not just the thyroid. So if you're doing a treatment or a test to look at the body with radioactive iodine, you can't just isolate it to a certain area.
No. Radioactive iodine for, let's say, Graves' disease. So the idea is, someone's got an inflamed thyroid gland that when you give radioactive iodine here, this will take up a large percentage of it, and then the radioactivity is going to kill wherever it binds to. Well, no matter how active the thyroid is, the person getting the radioactive iodine has breasts and ovaries and uterus and skin and prostate and pancreas and fat and pituitary and hypothalamus. All these tissues take up iodine. All that radioactive iodine goes in and can start killing and altering DNA and causing problems. And there's studies that clearly show that radioactive iodine use is associated with an increased risk of cancer, years later. So that's why I really counsel my patients to let's use that as a last resort in any illness, and if someone's got a mess of a thyroid gland, it's been inflamed and maybe infected for so long, similar to like kids who get these chronic tonsil infections, over and over and over and over and over. And, eventually these kids look chronically sick, and these kids have, bags under their eyes and dark circles under their eyes, and they're sick all the time. And the tonsils have just been so traumatized from inflammation and infection that I think surgery is warranted in those kids at some point. And when they pull their tonsils out, they become new people, immediately. And the same thing with the thyroid. When the thyroid gland's been hit with inflammation, and the thyroid gland can be infected too, like tonsils, but when it's over and over and over and over and over, and it's such a mess and you can't get things straight, I will recommend a patient do surgery first. And I've sent about 3 patients over 20 years for surgery on the thyroid. The rest we've been able to manage, pretty well with what we're doing.
Up until this point, we've talked primarily about iodine in supplement form. Is there any value these days, given the current food supply in the world we live in, to try and optimize iodine through food? I'm assuming not alone, but is there certain foods, as somebody who is so literate in this area, you try and take in on a regular basis for iodine specifically? And if so, do we have to regulate our dosage of a supplement accordingly?
Well, that's the best way to do it. The problem is the largest iodine source in food comes from the ocean. So it's either ocean fish or ocean vegetables. And the oceans are polluted. And they're polluted with the same thing that our world is polluted with, which is halides like bromide and fluoride. And these sea animals and sea vegetables have the same concentrating sodium iodine symporter that we have, and they can be overwhelmed with bromide and fluorides and other toxins. And so it's just, I don't think it's possible in today's world that you can do it. Can you help? Yeah, I mean, of course, eating healthier food is certainly good for any condition out there. I just don't think you're going to be able to get enough iodine in to maintain iodine status with, the amount of halides that we're exposed to right now.
We touched on this before, but I want to get into greater detail. Different ages and how much iodine people need. So we can take this all the way back to before a woman gets pregnant, during pregnancy, breastfeeding, And then kids, we've talked about middle age, and you've given some numbers there for adults. But older age, does it become more important as we age to take more iodine or less? I'll have you address the spectrum there.
Well, kids need smaller. It's just kids need smaller amounts of iodine than adults. Kids need more iodine at puberty, particularly girls, and because the first tissue to form in girls at puberty is breast tissue. Breasts are the second or third highest iodine concentration in the human body. You can't have normal breast tissue, breast architecture without iodine. And I mentioned earlier that iodine's needed for the normal architecture of the glandular tissue. So we call this normal architecture. And iodine deficiency, you get cysts forming. If it goes on longer, the cysts become hard and nodular. If it goes on longer, they take a hyperplastic appearance, which is a biopsy under a microscope. And then it's a precancerous look to them. And then cancer is the end of that road. And that's been shown in animal test tube and human studies to occur. And the same, different studies have shown iodine can halt and ameliorate this pathway and push it back to a normal architecture. So when kids...
Just jumping in for a quick second, how far down that continuum can somebody go and expect to see either some or total reversal?
I've seen total reversal. I've seen women with breast cancer or thyroid cancer or ovarian cancer who don't want surgery, don't want conventional therapies, just choose a holistic route. Look, does it work in everybody? No. But I've seen them be able to reverse it. That's not, iodine should be used as part of a holistic treatment regimen, not a standalone therapy. But with kids, girls iodine deficiency will really make its appearance in girls at puberty, because their iodine requirements go through the roof at that point. That's when thyroid problems and Hashimoto's will really come out in young girls. So they need iodine going into puberty to have enough for the breast tissue to develop normally. Right now, there are studies that show that U.S. women, 88% of U.S. women under autopsy have signs of fibrocystic breast disease, which is a precursor to breast cancer. And autopsy studies done 60, 70 years ago showed 3% of women had fibrocystic breast disease. So what's happened in the intervening time periods? Iodine levels have fallen, toxic halides have gone up, and we got more breast problems from that. We got more ovarian problems and uterine and thyroid, so on and so on. So kids need small amounts of iodine. In puberty, they start to need more. 25 milligrams for an adult. I don't change that for the age. The only thing I change it for is are they sick or not? Are they sick with glandular disease? Are they sick with cancer somewhere? Something like that. And then I'll use more iodine.
Talk about the special population of before getting pregnant, pregnancy, and breastfeeding.
So breastfeeding, the RDA for iodine is 150 micrograms per day, which you can get from iodized salt and food. It's harder now than it used to be 20, 30 years ago, but you can get that from food. Pregnancy and lactation requires a little bit more iodine. 220, I think, for pregnancy, and I think it's 290 now for lactation. Those are the RDA, the U.S. government's numbers. I don't think that's enough, but so the government recognizes you need larger amounts of iodine, in those stressful time periods for the body. But I think more is needed in our world that we live in today.
And as we talk about dosages and tying back to how we opened up talking about the fear around iodine, one thing to note is that a healthy body, specifically healthy kidneys, can excrete if we're taking on more than the body needs.
That's correct. Kidneys, if there's normal kidney function, 98% of the iodine taken orally, 98% plus should be able to be, the body should use what it needs when you take it in, the rest should be excreted normally from the kidneys without issue.
One area in your book I want to address is TSH, thyroid stimulating hormone. So people, when they start to take iodine, if they go to their doctor and have a thyroid panel taken, they may notice for a certain period of time, TSH goes up. So I think it's important we address what's happening there, give people that heads up in case this happens so they know for themselves and can explain to their doctor what's happening.
So an elevated TSH after someone starting iodine is a normal and expected phenomenon. And the reason is sodium iodine symporter, which is the taxi cab that moves iodine from the bloodstream into the thyroid gland or the breast or the ovaries, is stimulated by TSH. So when you're deficient in iodine, there's not going to be these taxi cabs waiting around for iodine. Body's not dumb. It won't put them on hold and just let them idle there. It's only going to make it when you take iodine. So the first thing that will happen is TSH will go up to make these symporters, and then it can move iodine into the cells. Once iodine reestablishes its levels in the thyroid gland, then TSH will come back down. So that's a normal and expected finding.
And do you find with people that are taking thyroid hormone and they begin what we're talking about today, taking iodine in a healthy way, within a certain period of time, that typically needs to be adjusted and monitored by the doctor? Just want to include for people that are taking thyroid hormone, even for long periods of time, I'm sure certain people that are listening to this, and if they're going to start to include iodine, what do they need to be aware of?
Well, I'll answer that. Some of your colleagues or your guests that have been on your show who say iodine causes Hashimoto's and, hypothyroidism and things, they'll quote these studies that say, well, they gave this group, this study population iodine, their TSH went up from whatever, 3 to 6 or something like that. And they call it iodine-induced hypothyroidism. Look, I see it in my practice all the time. TSH going up. It's not iodine-induced hypothyroidism. It's a normal and expected finding where TSH goes up because you need to make symporters. But if you look at T4 and T3 levels, which I do, they don't go down. It's not like they're hypothyroid. Those are normal. But if you just do a history and talk to the patient and listen to the patient and do an exam on the patient, they're not hypothyroid. They feel better. They'll report to you, I'm feeling way better. So the TSH is 10 or 15 for about 3 to 6 months. It'll come down. So it's one of the things when I teach doctors, I make a point of, you're going to see this on the lab tests. So either don't check it because it's going to happen, or just wait 6 months before you check the thyroid levels again. I'm sorry, I went back.
No, I got that part, but the part I wanted clarification is adjusting dosages. If somebody's taking, say, T4, and then they start to take iodine, and they're providing their thyroid with iodine, and we know you've mentioned before, T3 has 3 iodine as part of that molecule, and T4 has 4. So we know as we adjust iodine, it's going to affect these thyroid hormones. How do we adjust our medication and monitor that as we're taking on what we're talking about today?
I mentioned to you at the beginning of this talk that first 10 years of my practice, give or take a little bit, I had 3/4 of my practice on thyroid hormone and no one on iodine. I tried iodine on and off without success for that time until I met Dr. Abraham and, I learned about it. So once I learned about iodine, what I found over the next till now is I went from having 3/4 of my practice on thyroid hormone to 1/4. My average thyroid dose, natural thyroid dose, was 2 grains or 120 milligrams the first 10 years of my practice. Now it's 30 milligrams. So I've been able to take 50% of them off thyroid hormone. I've been able to lower the thyroid hormone dose in almost everybody. And people are feeling good, and the labs are maintaining. The exams are normal, and the history is fine. So the answer to your question is yes. Is hypothyroidism is the underlying cause of hypothyroidism an underproduction of thyroid hormone? They need thyroid hormone, or is the underlying cause iodine deficiency causing an underlying production of thyroid hormone, and they really need iodine first? So when I see a new patient now that's hypothyroid, I always check iodine levels. The numbers still hold true that most people are iodine deficient. I'll put them on iodine first and then check their thyroid hormone levels before I will put them on thyroid hormone levels first most of the time now.
Got it. No, that's incredible. What I was really getting at was the safety profile of somebody taking thyroid hormone and then introducing iodine and being wary of the fact that they may need or likely are going to need less over time.
No, you're right. You're 100% right. And look, if the underlying cause is iodine deficiency and you give them iodine, they're not going to need as much thyroid hormone they're on. They can get nervous, jittery, hyper, and they need that thyroid dose lowered. And I always tell my patients who are on thyroid hormone when I put them on iodine, hey, first sign of nervous, jittery palpitations, cut the dose in half, and we'll check your levels. But cut the dose in half and see how it goes. And then we sort of follow things. But no, you're right on that. That's exactly what happens.
All right, Dr. B, I know you got to get going here, but we'll end on this. Somebody that's going to start incorporating more iodine, whether they feel they need testing or not before, they're taking in more and applying what we're talking about today. Are there certain other nutrients, supplements, different lifestyle modalities, things they want to do to accentuate taking iodine? I know you talk about selenium in the book specifically. I want you to talk on that and other things that I may not be thinking of that can help facilitate transitioning to more iodine.
Remember, I started off by saying iodine should be part of a whole holistic treatment regimen. It shouldn't be used as a sole standalone therapy. So, every new patient that comes in my office gets a whole hormonal nutritional evaluation. I draw a lot of blood, a lot of blood looking for this, and hair testing, looking for mineral metal levels. So, we were pretty well designed by our maker that if we can supply basic raw materials to the body in a good form, body can do pretty cool things with it and maintain homeostasis to maintain or achieve health. So sure, selenium, B vitamins, magnesium, vitamin C, look, I check all these things. So I don't just willy-nilly put people on these. I try and target, where their deficiencies are and where they most need them. And, it's I've written 17 books. I describe all this in these different books. I have diet books. I have eating books, healthy eating books, iodine, thyroid, B vitamins, I cover all these in different books. So there's not one thing I can say, but look, working with, I always call it the health team, a good health team, a good physician who's got, who's literate on iodine and nutrition and things. I always, the doctor that turned me over to, holistic medicine was a chiropractor. Before I met him, his name was Dr. Robert Radke. Before I met him, I used to tell people don't go see chiropractors. They're dangerous. I never knew what they did or never met one before, never knew the philosophy or anything. And, when I met Dr. Radke, he knew more functional biochemistry than I did at that time because he was taught it and was working with it. And, so I think a holistic dentist, a holistic chiropractor, a holistic physician, all these people can be part of a good team, to each putting in a piece of the pie to sort of help you achieve your optimal health and help you get to better health. And so, eating good is, I call it the basics. The basics for me are maintaining hydration, drinking half your body weight in water per day at least, eating good food, not refined food, eating unrefined food, keeping salt levels up, and iodine. Those are the four basics that I see, that people can do. And, they do those four basics. A lot of people will be helped by that. And then, targeting the other stuff as we see fit.
All right, final question for you. Since you've gone over the importance of salt, unrefined salt, for the average adult, how much should we be taking in a day?
It varies. So you can check salt levels. Now, the salt ranges are huge. So the salt ranges don't provide for there's optimal levels in those ranges, but the range is way too big. It should be, much smaller. So generally, if you have normal kidney function, you're not in congestive heart failure, at least a teaspoon of unrefined salt beyond what's already in food and what you're cooking with. I have some people on a couple of teaspoons, a couple of tablespoons, depending on what's going on. But those are general rules for unrefined salt. And I talk about that in my salt book.
All right, Dr. B, really appreciate the conversation. This was great information. And it's definitely going to change the way I approach iodine for myself, my family, and I'm sure the viewers. So thank you again. We're going to link up your books, your website, everything in the show notes. Thank you, sir.
Thanks for having me.
Now that you're done, you're going to want to head over here and catch this next incredible episode. You don't want to miss it. I'll see you over there.
Most recent research suggests that over 90% of Americans fall short of the optimal intake of not just one, but several micronutrients. This is also true in other developed countries around the world. So there definitely has been